About 60% of newborns are likely to develop jaundice. Most of these newborns suffer from severe untreated jaundice conditions, have yellowish of the eye and brain damage. Doctors believe it accounts for about 40% of the deaths among newborns under the age of 5 at most health facilities in rural communities in the country, where access to health care is a challenge. These symptoms usually appear on the second or third day of birth and common among premature babies. According to Dr. Peter Kwarteng, a pediatrician with the Tamale Teaching Hospital, the children affected with such disease develop yellowish eyes and as well as yellowish feet, which makes them unhealthy and retard their growth.
Neonatal jaundice happens when a substance called bilirubin from the breakdown of red blood cells builds up in the body. Newborns usually have the levels rising about the third or fourth day, and then usually by the seventh day, fifth to seventh day, it comes down. But in some children, based on certain problems, such that maybe their red blood cells are breaking down, or the child's blood or the mother's blood are incompatible. There are other features like that. And when this one happens, the yellowing of the eye starts, then it goes to the lower part of the body, and then eventually, if it gets very severe, realize that even the soles of the feet are yellow. The problem that we see with it is that though in many children it rises, it is eventually cleared. But for those that have an underlying problem, if it continues like that, the most severe danger that we realize that it can stain the brain, what we call kernicterus. And once that happens, even if we are able to save the child has several complications going into later childhood and then adulthood.
He further noted that if parents are well educated on the matter of jaundice, the situation could be managed.
Even at 1 year, some children are not even able to sit. So realize that if the parents are well educated, some of these things which are very preventable can be managed. So one of the things that we are launching hopefully within this second quarter is to start a parental education class showing them vivid pictures and videos, so that the parents will really appreciate what actually happens in cases such as neonatal jaundice, how to detect them early, how to get to the hospital early, and then what to do when they are confronted with cases like that.
Dr. Peter Kwarteng called on communities to join the Neonatal Network Support Initiative to fight against neonatal death, as well as its advocacy efforts in the northern region to support 11 facilities in the region. Noah Nash, for Versa One News.